Welcome to Senior Focus. My name is Laurie and I'll be your host. Here at Senior Focus, we hope to bring you news and information about aging well. Today, I'm really excited to welcome Sarah Littlefield. Sarah and her husband Chris are the owners of BrightStar Care, a home care agency. Welcome, Sarah.
Thanks for having me, Laurie.
I'm so glad you're here.
Me too.
So can we start by talking about what a home care agency does?
Sure. We provide care to people in their homes, whether that home is a private residence, an assisted living community, an independent living community, even a hospital or a rehab if there's been an event which causes someone to leave their permanent residence. And we provide support services of all different kinds, from very light homemaking and companionship through skilled nursing. So when I think about the different services that we provide, I really think about three different levels of care. The first one is homemaking and companionship, and really that includes all sorts of services that don't include touching. So I don't mean to imply that if you were to have somebody come to your home for that level of service that there'd never be hugs or any kind of interaction, because that's certainly one of the nicest things about having some support in the home. But those are services that would include meal preparation, transportation, laundry, medication reminders, playing games, companionship to an appointment, socialization, that kind of thing. The next level that we get into involves personal care. So at BrightStar, the way that we distinguish between that first level and the second level is that the second level does include touching.
Got it.
So those would be activities of daily living like grooming, bathing, dressing, toileting, oral care, personal hygiene, that kind of thing. And so for that level, we use licensed, certified professionals. So we hire both certified home health aides and certified nursing assistants. So they would be the level of caregiver used for any kind of personal care. And then the third level.
So the certified home health aide is the one that's doing the not hands-on as you described.
Actually, it's probably a little different because at BrightStar we only hire certified individuals. So in another agency they might use, an experienced person with a loving heart and lots of great experience
Gotcha.
to do the non-touching kind of stuff.
Yep.
There are lots of great individuals out there who have phenomenal experience and who provide absolutely wonderful hands-on care. For us at BrightStar, because we're an agency, we really believe in going above and beyond and doing some of those extras. So one of the ways that we try to guarantee to families that they're getting absolutely the best care out there is by only hiring professions who are licensed or credentialed in some way. So that may not be the case with all agencies. I don't want to speak for anybody else. All of my experience comes from BrightStar. But the way that we distinguish between those two levels of care is that one involves touching and one doesn't. Gotcha. So the companionship and homemaking, I could actually do that, and I have before. If we've had somebody running late or something like that, I want to make sure that we uphold the promises that we've made to the people in our care. So I've definitely gone and done some vacuuming, made some beds, I always kind of think at least someone else's laundry is getting folded, even if my own isn't. But that's why I can do that kind of care, because I'm not a licensed professional. I'm not an aide. I'm not a certified home health aide or certified nursing assistant, so I can't do anything that involves touching. I couldn't help somebody with toileting or grooming or dressing or anything like that. So that second level requires a certified nursing assistant or a certified home health aide. And then the third level is nursing. So that requires an LPN, which is a licensed practical nurse, or an RN, a registered nurse. And that kind of care might involve a dressing change for a wound. It might just be something as simple as a well visit and seeing how someone's doing with blood pressure and that kind of thing. It might also involve some ostomy care, or really anything that involves a higher level of clinical training.
Gotcha. So is it typically seniors that you're going to see?
In our case it is. I think that one of the things actually that brought Chris and me to BrightStar is that we work with infants through seniors. Wow. So there aren't a lot of agencies out there that do that. And so I love that we see people kind of across the spectrum. And when I think about it, I think our youngest client was about 4 days old.
Oh my goodness.
And we've also worked with people who are over 100.
Oh my goodness.
So that's pretty fun.
That is.
It means that, the people on our staff have a wide range of interests, and it also means that they get to see all sorts of different people. And for us too, it's nice to have a population that is so varied. So I think that's different about BrightStar, but we're so lucky here in Boston that we have all sorts of different agencies and lots of different options. Most of them, I believe, that provide in-home care as we do, tend to service seniors, or at least adults.
Gotcha.
So,
So when would somebody know that it was time to give a company like BrightStar a call? How does somebody know that when it's time to call in that extra set of hands?
That's a great question. If it's okay, can I give some examples as I think about?
Sure, I think that'd be great.
Because I think that we see so many different cases and so many different families that I might do better if I'm able to kind of pull things from my hat. I think that the question that you ask is probably one of the hardest ones to answer. So many of us want to try to do things ourselves, or maybe I'm just speaking for myself and thinking about my own parents, but I think once you've been independent for a while, you want to try to hold on to that for as long as you can.
Right.
And sometimes people like you and me, where we're kind of in that sandwich generation, we have older parents, we have younger kids, we also don't want to undermine our parents' independence, and we want to try to show them that we're being supportive while also getting them the help that they need.
Yep.
So the question that you ask is a good one. A pretty easy way to think about whether or not you might need the help from someone, whether it's an agency like BrightStar or whether you might know someone in your community that could help out, is a short-term, one-time only kind of situation. So I think about, for example, one of the very first cases that we did a couple of years ago, a gentleman called and he needed a medical procedure, and I think it was about 40 minutes away from his house where he was going, and he knew that afterward he was going to be under some anesthesia and wouldn't be able to drive home. Sure. So he called us, and we had a certified nursing assistant, and she took him where he needed to go, waited for him, then took him home, so he didn't have to worry about then having to go back and get his car later and that kind of thing.
Right.
And then she also got him settled, made sure that he had all the paperwork when he was discharged, that he had all the medications that he needed, that they gave him, made sure that there was a glass of water by his bed before he took his nap and that kind of thing. So that was definitely a finite need that somebody had. We also serviced a family that came into Boston for a wedding, and I don't know if it was that kids weren't invited or if they just kind of wanted to cut loose a little bit, but for one reason or another they came to Boston and their kids weren't going to the wedding and they didn't know anybody here. So I've been in that situation before too, when my best friend got married in Dallas and I didn't know anybody. Right. And it's a big deal to choose to have someone take care of, whether it's your aging mom or your young son. How do you know whom to hire? Sure. So they actually contacted us and we provided care and made sure that the kids were fine and they had dinner and they went to bed and they had bedtime stories, and then the parents got to have a great time out at their wedding and come home and know that their kids were safe. So I think those are two examples of a one-time only event when you want to make sure that your loved one is safe and well cared for, and you might not necessarily have resources on your own. Yep. So that might be one reason why you'd call a home care agency like BrightStar. I think another reason would be a short-term need. Okay. So let's say there's been an event, and something that you hear often in the senior community is somebody falls and breaks a hip or something. And really the event can be anything, any reason why somebody might leave home and either go to a hospital or go to a rehab and then be discharged home and need some support services to get back on their feet. Yep. So we would provide something like that, and there's a whole range of services that somebody might need, but hopefully you can think in your head about a situation where, and again I'm using the kind of the breaking of the hip, but someone leaves home, goes to the hospital, goes to rehab, gets some support services there, probably PT and OT and that kind of thing. And then when they go home, they just need a little bit of extra support in order to get back on their feet again. Yep. So I think about one woman whom we saw, she'd actually had an accident at work, and she'd broken both of her elbows. Can you imagine? No. I know. She fell, kind of braced herself. Oh. I know, poor thing. And she couldn't even open a bottle of water. Oh, my goodness. It was summertime. It was last summer, 90-plus degrees. She couldn't dial the phone. Oh, my goodness. She couldn't open a bottle of water. Nothing. She couldn't get herself dressed. Oh, my goodness. So in a case like that, you might use an organization like BrightStar in diminishing need. So when someone gets home, they probably need a little more support, and yet as they get better, you're going to want to have the opportunity and the option to pare down the hours for which you've contracted an agency, and we do something like that. So we might start with more and then cut down the hours as somebody's independence gets greater. Wow. And then I also think about an ongoing short-term need, which is another reason why you might call an organization like BrightStar. So I'm thinking about a gentleman that we see 7 days a week for an hour every morning to help him get out of bed and get bathed and get dressed. And he doesn't live alone. He actually lives with his wife. He's a pretty big guy, and she's an itty-bitty thing. And so while she can help him, really what we find is that while we're providing care to him, we're also giving her a little bit of respite.
Sure.
And that helps both of them. So often with the families that we see, although there's someone in the primary role of getting that care, anything that we do to keep the other person safe is helping both of them.
Sure.
You know, so I even think about Chris's parents. His dad was the primary caregiver for his mom. And when we thought about them, we just said, you know, Dad, if anything happens to you, you're both done. Like, you're out of here. You can't live in your home anymore. And so when you're thinking about, you know, if you're thinking about your parents and maybe they're getting along okay and one of them needs help, really if you can get that help, you know, in this case for the gentleman, when we get him up in the morning, we're kind of maybe saving his wife's back a little bit.
Right.
You know, if she were to hurt her back, if she were to take a fall or something like that, there's no way they could stay in their home.
Right.
So we see them ongoing, for a short visit every morning for just an hour. So that's kind of the third thing that you might do, a short visit on a regular basis.
Yep.
And then another reason why you might call would be for longer hours. So there are many people that we see for between 6 and probably 12 or 14 hours a day, really when someone's awake. So when I think about one couple right now, we're there pretty much from when they get up in the morning, and usually when we get there is when we usually get them up in the morning, help both of them get ready for bed, get ready for the day, get showered, choose an outfit, get dressed, we make them breakfast, kind of get them settled for the day, and really when you think about all the different activities that you do during the day that you're able to navigate by yourself, imagine if you couldn't see or walk or do up buttons, or, you know, pour yourself a glass of water or that kind of thing. So for longer needs, you might also call BrightStar. We see a lot of families, a lot of seniors where the adult children work during the day. And so, you know, we really provide everything that somebody needs to keep their life going, transportation to medical appointments, you know, some socialization, meal preparation, laundry, homemaking, and that kind of thing. All that stuff goes on during the day. And then I think the last level of care is really the 24-hour or live-in care. So there are some people that, for a variety of reasons, need somebody with them all the time. So that might be because of a diagnosis like dementia or Alzheimer's, where different states of confusion might lead them to not even be able to navigate their own surroundings. So you don't want someone to wander outside. You don't want someone turning on a stove. That might be a safety hazard, something like that. And then there are also people with different other medical conditions that might require care, whether they have an ostomy of some kind, or maybe someone uses a walker, and it's always a fall risk. And so you want to have somebody there to make sure that they're ambulating safely and that there isn't an accident in the home. So there is a difference, I should say now, there's a difference between 24-hour care and live-in care. So 24-hour care, I should say live-in, somebody's there the whole time. It's not like they're living there and then they take off at different times. But when you have 24-hour care, it means that somebody's awake all the time. Live-in care, at least here in Massachusetts, means that the caregiver has the right to a certain amount of sleep at night that is uninterrupted. It also means that that person gets some downtime during the day. And so there are a number of different labor laws there, but it does mean it's a little cheaper to have live-in care, but you provide meals, you know, their electricity, usually it's expected that someone's going to have, you know, a TV or internet access or something like that. And then if you have a live-in caregiver, that person stays there, they need to have their own room and they get some downtime during the day, but they also don't have to be up at night. There may be some families where you really want to have somebody awake all night. And we have several cases like that as well, where someone might not be safe to walk at night, might get up several times during the night to use the restroom, might wake up at night and then be awake and be confused and need to have somebody there to ensure their safety.
Wow. Wow. That's interesting. I didn't realize the distinction between the live-in and the 24-hour. So when somebody's looking into what their options are and what those need in trying to address the needs that they have, how would they go about paying for something like this?
That's a great question. I think that the case like BrightStar, we're actually a private pay organization. So what that means is that it's all out of pocket. So that said, there are some insurances that we take and that other organizations take. So we do take long-term care insurance. If you don't know about long-term care insurance, I would definitely recommend talking to an insurance agent. A lot of changes have happened in that industry recently. It used to be called nursing home insurance, I think, and now it's just called long-term care. But anyway, so long-term care will often pay for home services. I mentioned previously one of the people that we'd seen through workers' comp. So yeah, so BrightStar actually has a number of affiliations with different insurance agencies, and they will get the case and get the specifics of what's happened to somebody on the job, and then that company contacts us and pays all of our bills, and then we go and provide the care for people in their homes. Gotcha. And then there are also local organizations. There are, in Massachusetts anyway, they're called ASAPs, Aging Service Access Providers. They're all over the place, and you can go and qualify for different services. Often those will be of the shorter variety that I mentioned earlier. So you're not often going to get 12 hours a day of care paid for by the state of Massachusetts. Sometimes it might happen. I don't think it happens too much. But you might get, bath service daily or something like that. So that might be between an hour and a half, someone to help you get up in the morning, get ready, dressed for the day, and then that might also happen at night if you need help going back to bed. So, so we provide a number of different services. I'd say most of them are private pay.
And so is that something that you could assist somebody with if somebody were to call you and say, this is the need I have, this is the insurance I have, this is a bit of my financial situation? Is that a piece that you'd be able to help them sort of navigate and find out what's available for them?
Absolutely. And I would say I'm not an expert in a lot of those realms, so I'm a big person for asking questions. So we have a lot of people in our network who do know way more about all this than I do. So we have obviously people with whom we've established relationships, and so we're always happy to try to get people to have our services paid for by other people rather than themselves, because it is expensive and we all have bills to pay. So absolutely, we would try to steer people in the right direction, definitely get them hooked up with some of the state services first. And then if that's enough for what they need, great. And if we can just supplement, then that's fine. So we do try to get as many services covered as possible and try to get as many people looking after our seniors as possible. You know, the wider the net, the better situation we're all going to be in.
Sure. Right? That makes sense. Sure. So I understand that there's agencies out there, and then you sort of referenced earlier that there might be somebody that has had experience providing care for a family member. So they just sort of, while they don't have any certification, they have life experience. How, as an individual, when you're needing this type of care, this type of service, do you know whether to call an agency or go to the classified section or to a Craigslist? How can you talk a little bit about how you make those decisions and what the benefits are?
Sure. I think that, first of all, there are so many wonderful people out there who do what we do on their own. I, of course, am much more familiar with the practices of BrightStar because that's what I do. So I tend to make reference to that more, but absolutely, I should say right off the bat, there are wonderful, wonderful caregivers out there. And the primary reason, I think, why I hear about people hiring somebody privately as opposed to going through an agency is cost. And cost is a very real factor for most people. I know it certainly would be for me. And I've used babysitters before. I mean, I do that for my own kids. I've also used an agency, and it's always cheaper 99% of the time. It's going to be cheaper to hire someone privately just because of all the overhead that it takes to run an agency. And I'll talk about some of the things that we do at BrightStar and that you're probably going to find at any other agency that costs money, and if you engage in a contract with somebody privately, it's just going to be less expensive. Right. So I could see that being one reason why you might choose to use someone in your own circle. I also think that if you already are fortunate enough to know somebody who does this work, and if the person for whom you're contracting care also knows that person, then that's one new face you don't need to introduce. Some people do really well with change and some people don't. And so if you're looking for care for your mom, for example, and there's already somebody that your mom knows who does this, then great. They already have a relationship with one another and they already have something in common, so you don't need to worry about that kind of introductory period.
Right.
So I think those are two reasons why people might, right off the bat, choose to go with hiring somebody privately or maybe placing an ad on Craigslist. This isn't to say anything disparaging about Craigslist, because I'm sure it's a wonderful service in all sorts of ways. And I think that there are many advantages to using an agency. So I can tell you a little bit about that. The hiring process in and of itself at any agency is time consuming. And so I don't know that many people who have the time to sift through everything that comes on Craigslist. You know, if you do choose to post an ad there, it takes a lot of time to weed through people's resumes, their contact information, calling them, meeting with them, figuring out where you're going to meet with them. You know, do you actually want them coming to your home, and knowing where you live if you're about to engage them to maybe care for someone who is infirm, you might be opening yourself up to some safety risks there.
Sure.
So just the whole process that goes into hiring someone is time consuming and expensive in and of itself. If you use an agency, they're already doing all of that for you.
Right.
Agencies are also required here in Massachusetts to do a background check. So the Massachusetts state background check is called the CORI. Most people know about that. That is a minimum requirement here for any agency that is licensed to provide care. At BrightStar, we also do a national background check. So we realize that not everybody stays in Massachusetts all the time.
Yep.
The Bay State is a fabulous spot. I'm glad I live here, and I haven't lived here all my life. And many of the people who work with us weren't born here and haven't lived here their entire lives.
Sure.
You know, here in Boston, we're also really fortunate that you can drive an hour and be in like 5 other states.
Right.
You know, so the national background check, we think, gives an extra added level of safety
Sure.
to the people in our family. So we do that. We also do a drug screen. And we check with the Department of Public Health and the Office of the Inspector General to make sure that all of those people in our employment don't have any kind of charge against their license, you know,
Wow.
for elder abuse or something like that.
Wow.
So when you go to an agency, you're going to want to ask if that's something that they do. Their answer should certainly be yes, and if it isn't, you probably don't need to ask them any more questions. So the background check piece, I think, is an important one if you're thinking about engaging, whether it's a private caregiver or an agency for some care. And if there's anyone out there who is thinking of going the Craigslist route, there are private organizations that will do background checks for you, you know, and so I certainly know of a couple of them. They do a great job, and they can do the same kind of thing that an agency will do on a one-off basis, you know, to make sure that if you find someone privately that you love, or if you already know somebody and you just want to make sure that they're on the up and up,
Right.
there are services that will do that for you on a one-off basis.
And so is one of the other benefits of an agency, I'm guessing, let's say, for example, the caregiver's sick. Does that then become the person receiving the care's responsibility, or would that become your responsibility to fill that shift?
You're great at asking these questions. Absolutely. I think emergency planning is one of the greatest advantages that an agency offers.
Yep.
And when I think about emergency planning, I think about two different things. So there's exactly what you mentioned, which is if you have a private caregiver and that person is sick, or they have an accident or something like that, then what happens to your loved one? You know, the person that you're caring for, or the person that, you know, you've engaged this other person to service, you want to make sure that there's always going to be somebody there. So with an agency, you have that guarantee. You know that although there's going to be a regular team of people or a regular person who might see your mom or your daughter, whoever it might be, when you use an agency, you also have that added guarantee of knowing that if for some reason the regular caregiver is delayed or sick or something like that, there's a death in the family, who knows, that your loved one is still going to get the care that he or she needs, because we would send somebody else. The other part of emergencies that I think of, you know, reminds me of the wonderful snow that's outside right now. And a couple weekends ago when we got that blizzard, one of the things that we need to do for our various accreditations at BrightStar is we need to have an emergency management plan and emergency preparedness steps. And so we work with all the families in our care so that they understand what they need to do in terms of having water or electricity or that kind of thing. And then when I think back to, what was it called, Nemo? The blizzard that we had, the planning that we did that went into that was pretty extensive. And we had to kind of come up with levels of care. There are some people that we see where we have to see them, whether it's because they have 24/7 care, you know, they might fall. There are people we see for feeding, obviously you need to eat, you know, and then there are those people that we see for companionship, and that isn't really a necessary service as defined by the state of Massachusetts when Governor Patrick said, you know, only emergency healthcare workers are allowed on the roads. So when I think back to that weekend, between about 7 o'clock on Friday night and noon on Sunday, Chris and I drove about 300 miles in Metro North and on the North Shore. Chris is from Vermont, right? So he heard about the snow, and this was a very fun event for him. Even though I'm from Canada, I'm kind of a faux Canadian. I didn't get my driver's license till after I'd finished college. So he was very excited about the snow and driving people around. So one of the things we did is we wanted to make sure not only that the families in our care got the service that they needed, but also that our caregivers were safe. And not everybody feels comfortable driving in the snow. So we drove around and picked people up and dropped them off and took them where they needed to be. And wanted to make sure that both our employees and the families in our care were safe. So those are the two different aspects, I think, of emergency planning that are advantageous when you use an agency as opposed to a private caregiver. There's also the certification and licensing piece of the pie. I mentioned before that we use either certified nursing assistants or certified home health aides. And so when you use an agency, that agency needs to make sure that everyone's credentials are up to snuff. At BrightStar, all of our aides are also certified in CPR, so we make sure that that doesn't lag. And here in Massachusetts anyway, the CNA, the Certified Nursing Assistant designation, is a license that requires that you re-up it, that you renew it every 2 years. So we make sure that that happens. In some states, home health aides are also licensed and they need to re-up that. In Massachusetts, that's not the case. So once you finish a home health aide course, you get your certificate of completion, you're done. We, however, at BrightStar, we want to make sure that people are always learning and growing, and so we offer in-services, and in-services are essentially like little classes. They usually take about an hour on different topics. And so certified nursing assistants are required to do 12 of those a year in order to renew their license. At BrightStar, we say that our home health aides do as well. So we make sure that everyone's getting at least those 12 contact hours of learning something new and making sure that they're maintaining their professionalism and learning stuff that's going to be helpful to people that they serve.
That's great. Well, thank you so much. This has been fantastic. I know I've learned a ton about what BrightStar and other agencies like BrightStar would offer. So that's been a great help. Thank you.
Thank you so much for having me. This is so fun, Laurie.
Thank you. And if you have any questions and want to reach out to Sarah, please feel free. You can reach her at 978-278-3320. And certainly if you have any questions or show suggestions, I'm very open to show suggestions, give me a call. Again, my name is Laurie, and I'm at Meadow Center. And my number is 978-276-2010. Thanks for joining us, and we look forward to seeing you again next time. So until then, stay well.